So, all right, we're going to get going this evening. I'm going to start off by letting our guest speakers introduce themselves. Tonight we have Haley Hintz and Dr. Maribeth Bundy here to present, and I will turn it over to them to give a brief introduction before we get our PowerPoint started.
Dr. Vanover, if you could share a PowerPoint, we have a little
Oh,
introduction slide
well,
that might
then I
help
would be
us
happy
remember
to.
who we
Oh,
are.
yeah, we sure do. While
Yeah.
she's looking for that, I'm going to tell everybody I'm coming to you from Bell County. I see some of my neighbors in there from Knox and Harlan County. I tell you, I just love seeing all your names, seeing your organizations where you work. You guys are the superstars of the state, as far as I'm concerned. I can't think of any work that would be more important than the work you're doing. Taking care of and getting foundations underway for citizens of our state and our country. So thank you so much. Let's see. Dr. Vanover's at the end. She's going to see if she can get to the beginning. We're going to be talking about toilet training or toilet learning today. And I'm certainly hoping that you'll stop what we're doing, raise your hand, interrupt us, and ask questions and give us your wisdom because my guess is that we have some very experienced toilet trainers here tonight in this group. I've done quite a bit of it myself, but I can always learn more. Let's see, keep going, Dr. Vanover, and you'll see our intro slide. That way we can. Oh, yeah, and here's what we're hoping to do. We're going to talk about some of the things that make it difficult to toilet train a child who has some developmental delays or disabilities. We've got all kinds of strategies just to get you thinking about what you do, and we hope that you come up with a couple of new ideas by the end of the night. And then for me, I think a lot of people are, it's hard to find the time to toilet train somebody who's not doing it very easily, who's not figuring it out very easily. And we're going to talk to you about the rationale for independence and safety behind getting toilet learning independent, toilet skills independent. Let's see, here I am up here. I'm a clinical psychologist and board certified behavior analyst. I grew up in the hollers of Kentucky, went to college in Kentucky, and then went to graduate school at University of South Carolina, University of North Carolina, University of Colorado. Came back to Eastern Kentucky University in the mid 90s, and I've been here ever since. My specialty is autism, developmental disabilities. I've done a lot. I've never worked in a daycare or preschool, although I wonder if that would be, I wonder if y'all would take me as a post-retirement career. But I have worked with lots of toddlers, and I've done a lot of direct care work with people of all different ages. So I've worked quite a bit with toilet training. And last thing I'll say is that I have 6 children now that are grown of my own. So I have a lot of personal household experience, at least six experiences with toilet learning with kids. How about you, Haley?
Yes, and I'm Dr. Bundy's student at Eastern Kentucky University. She has trained me in everything that I know. I did work in a daycare for quite a while, so I have seen some of the barriers to toilet training, but I will say I'm probably not as expert as all of you. So I hope that we can help teach you something tonight. If you need to eat, drink, relax after a long day working with the kiddos, we totally get it. But maybe some of you are on summer break, which I would love for you all.
Yeah, I value your perspective. I think the audience will too, Haley, since you've done some daycare and preschool work.
Yeah.
You may find that some of the things that I've written are written on a more individual level, and you'll be thinking, hey, I can't do that with a class full of kids. So I'd like to hear about how that does work for you. And maybe Haley can bring some perspective in within a preschool setting as well.
Yeah, so just as a quick introduction, we know that toilet training can be especially challenging for kids with disabilities or children on the autism spectrum. It's not easy for any kid. This is one of the first complicated skills that a child is going to learn throughout their life. But there's some reasons that it's more difficult for a child with a disability. And we know that as many as 50% of children with ASD are going to have toileting challenges, toileting delays, and that's normal and expected. And they may not be toilet trained at the same time as their neurotypical peers. We know that challenges with constipation, sensory sensitivities, and anxiety are all working together with autism, increasing those challenges. And the age that a child with a disability toilets is going to be so different depending on the kid. We could throw out an average. The average autistic kid is toilet trained by age 4, but some children may or individuals may never be toilet trained, and some may be toilet trained on time with their peers. So it's just so different for each child. And then we know that cultural differences in families and families with children with autism exist. Some families, this is a skill that they really value and is very important to them. And so they may be working on this skill for longer or earlier in their development. And for some families, we call this like the sock theory. Like, this is something they don't care about. I don't care if you have mismatched socks today. I don't care if you're toilet trained right now. Like, we're trying to keep you safe from other, like banging your head or other things that they're working on in the home. So it just may not be a priority. Some more kind of nitty-gritty reasons. Toileting is a complex skill. There's many steps. We know that kids with autism learn in steps, so there's more to master with toilet training. They're also going to have differences in social motivation and understanding. So, a neurotypical child may see their peer in the classroom sitting on the toilet and getting a prize, and they're going to be really motivated by that. They're going to think, wow, I want a prize too. But a child with autism may see that and really not care about the social aspect of toileting. Same thing with modeling. So, they may, a neurotypical child may see their peer and be able to think, oh, wow, I see that they're pulling down their pants, sitting on the toilet, and can break down those steps within their own brain, whereas a child with a disability may not be able to do that. Children with disabilities may have stronger adherences to their routines. A diapering routine is something they know well. They've learned this innately, as they've grown up, and they might want to keep that. Um, we know that they have what we call interoceptive differences. That's body differences internally. Just neurologically, they are wired to have differences in recognizing their body cues. So their stomach may actually hurt more than their neurotypical peers, or they may not actually feel the physical sensation of having to use the restroom at the same rate. Um, there's a lot of sensory things going on in the bathroom. I mean, there's noises, there's lights, there's a cold toilet seat, and that may be aversive to kids with autism. And we know that autistic kids in general, this is a broad generalization, but they may have cognitive or learning differences that make them learn at a slower pace throughout their life.
So I like this model. It's called the ziggurat model. You can see it over on the left. The idea is that what we tend to do is go straight to level 5. I want this child to learn how to use the toilet. I want this child to leave diapers behind. But to really be successful on that level 5, we have to look at foundational things on level 1, 2, 3, and 4. And Haley just talked about managing sensory differences and biological needs and making sure you've got medical support, and occupational therapy support. We'll talk about some of the therapists that can help with managing that first level. Level 2, if you're expecting somebody to give up their diaper routine, especially if they've had it for a few years longer than some kids might have it, you better have some big reinforcement. You better have some big rewards because the routine itself probably feels pretty good. Level 3, structure and visual and tactile supports. You better have the right kind of underwear. Probably it shouldn't have tags. Maybe it needs to have the favorite thing of the person on it. And I think Haley has some examples, and you guys probably have some examples too of visual supports, visual schedule kinds of things to help kids know when, how, and kind of guide them through their toileting routines. And then level 4, what are the task demands? I think I've got a slide in here at some point where I talk about a strategy you could explore to teach children how to sit on the toilet one tiny, I think it's 5 seconds at a time, but it could even be 3 seconds at a time. If you have a child that can't or won't sit, then you're not going to be able to leap into toilet training, right? If you have a child that can't pull their pants up and down, that might be a pre-skill that you'd work on too. So think about the foundational skills that you might be working to get in place as you're aiming toward that big level 5 toilet learning skill. As I said, tiny little goals. We're not going to start by saying we might want to end for bowel training with kids sitting for 10 minutes, sitting and waiting to see if a bowel movement happens for about 10 minutes. But that's not going to be the first step, right? We're starting in the seconds in the beginning when we're teaching kids how to sit on a toilet. Collect data. I think I've got some sample, all kinds of different ways to collect data, but you'll be able to set your routine up better if you know a little bit about what the child's patterns are like. We talked about this already. Assess dressing skills. Make sure you don't have fears going on that need to be addressed, or that maybe the environment needs to be addressed to avoid triggering the fears. My daughter would love this story. She'd love that I'm telling it, but it's a good one. When she was 3 and we were working on toilet learning, she was really afraid of auto flushing toilets. I don't know if anybody you're working with, and I don't know if you have those at your daycare. I hope not, because those industrial right type toilets can be loud, and it's just shocking if you shift and it happens. So for her, one of the first things I had to teach her is to cover that little sensor with a post-it note, or with something like that, so she would feel safe that it wouldn't suddenly flush. So just an example of the kind of fear. I see a lot of older kids on the autism spectrum who are afraid of public bathrooms. And sometimes you're not sure why. Is it the volume of the toilet? Sometimes there are echoes in those big tiled rooms, they're larger than a home bathroom. And we want to generalize toileting skills, so we've got to assess that and try to work through it. And we've got to do preference assessment to find out what they'd like to work for, what's really motivating. Sometimes we go for small prizes for urine training, and sometimes we have to go for some pretty big prizes, some, pretty big motivators for what my son used to call pooping prize. He wanted something big for the pooping prize because it seemed like a big effort to him. So signs of readiness. It might be a little different for kids with developmental delays versus kids that are developing typically. But on the other hand, I like to emphasize getting a routine started and starting to make some strides by 4. If the child is healthy, found healthy by their physicians, even if they aren't showing a lot of readiness. And here's why: humans, and maybe animals too, probably so, living beings, let's put it that way, can get really conditioned about how and when we toilet. So if we have a child who's 8, 10, 12, and still we haven't tried any toileting and they're still using diapers or pull-ups, that conditioning for that pull-up use is very strong. So, certainly you're not going to push toileting at age 2 if you've got a child with complex needs and you're dealing with all kinds of other skills issues. But by around 4, if they're healthy, you may decide that it's time to get started, even if they aren't asking to go potty, imitating others on the potty, taking off their diaper, some of the things that we're looking for. We hope we can observe longer periods of dryness for kids that are getting ready to start a toileting program, and we're going to have to do pants checks to be able to see if that's going on. We hope they can tolerate some gentle spoken or physical directions like sit on the potty, come to the bathroom. We hope their bowel movements are healthy and formed. Probably most of us have some experience with kids whose bowel movements are so unpredictable and so loose that you kind of know that it's going to be pretty difficult to get a routine going there. What would Dr. Toomey say, Haley? We're looking for one big soft poop per day. If you have that, and you can collect data and kind of get the routine and the timing down, that's going to be a lot easier than kids that are having, loose stool 20 times per day. So sometimes you have to get a GI specialist working with you on this stuff. And then the last thing, caregivers have to be ready to dedicate time and effort, not only teachers and childcare workers, but also parents, right? We would try to get the whole team together to work on it at once. You need some supports, you need some relief people in place because this is not easy work.
Mhm.
So for kids whose parents and care workers, care providers are interested in teaching them how to sit on a toilet, I think our target is 3 minutes of cooperative sitting. And you may start with 5 to 10 seconds, depending on what the child can tolerate. Pants down, sit. 1, 2, 3, 4, 5. Pants up. You might try this 10 or even more times per day if the child will do it. If they won't sit, you can gently hold them for 5 seconds. You can count with them and then back away. Even if you can get them sitting for a second by themselves, then you can do a big reward. It's a new skill. It takes time and patience, but you'll be more successful with toileting if you can teach sitting on the toilet. If they're afraid of a big flushing toilet, you might do this kind of practice on a little potty chair. I like getting a potty chair that looks like the big toilet at home. So I like, a white sort of standard looking little potty chair if you're going to use it. And then as you're having success with this, you can increase sitting time by 5 to 10 seconds. Now, this can be irritating because you feel like you're not getting anything else done, right, when you're working on this. I guess my argument would be that this is a critical skill and it may be worth taking the time to work on it.
I also just want to say it looks like we have some people in the waiting room trying to get in.
Oh,
Just saw that in the chat.
So after the first 5 minutes, people can't enter the training because they technically are not allowed to get an hour and a half credit when they didn't attend the hour and a half class. So, um,
gosh, everybody who's here, pat yourself on the back. You made it
Yeah.
on time. Good job.
I'll scoot you forward.
So I could have formatted this better, but I just wanted to show you a couple of little ABC data kinds of things. I think I've got another, actually one that I'm more likely to use following. But so this is more extensive data that might help you look at, avoidance behavior. Oh gosh, this child seems to find toileting practice aversive, or oh, this child had a potty accident. When do they usually have accidents? What time of day? What happens after an accident? So this is more detailed information. Now turn to the next slide, and you'll see what I'm more likely to use, just because I'm busy a lot of times. So I might use something like this: toilet success, toilet accidents, what time is it? And ideally, you could put over here, we were in music class, it was center time, it was movie time, and try to get an idea of when they usually go and maybe what the situation is during accidents or successes. I'm not great at making these kind of charts, but some of you may really be uh, very creative at this.
Yeah. So thinking more so about what does it look like, when we're talking about that pyramid that Dr. Bundy was talking about earlier for the child with a disability. Well, we of course need to think about their disability. This presentation is kind of geared towards autism, but it really is general for any kid, even without a disability. But our first goal is kind of to just increase social motivation and understanding and introduce them to the concept of a toilet or a potty. And so some ways that I'm sure maybe you all are already doing this in the classroom is to utilize social stories. You might read a story about going to the bathroom. If you're have so much time on your hands and so much planning time, which I know you all do, you might make a story with that child specifically in it. I know teachers pay teachers, or there is a free website as well where you can insert photos of the child or the child's own bathroom and it kind of like auto populates into the story. So they can kind of generalize what that bathroom looks like at school or at home. You can work with their parents to just introduce them to the concept. Um, and then, with consent, the child could observe a sibling or a peer. I don't know how consent would work for something like that in the schools, but just observe them using the bathroom. And, when they're doing these observations, model using labeled praise and rewards to an extreme level. You might really get excited about that sibling or that peer using the toilet, and they might see their peer get a huge prize that they wouldn't normally get because, of course, they've mastered the toileting skill. Um, and if interested in toys or playing pretend, you could use some little toys like this doll over here, or their, favorite interest. If it's, Paw Patrol or Roblox, how can we show a toilet using something that they're going to be interested in and attend to? It can also sometimes just be a YouTube video. Um, just whatever the child would find interesting for a couple of minutes to
This little
introduce them to
toy,
anything.
this is really adorable. I've seen people do little toileting centers, so it might be like Velcro matching. You can put, a Chase cutout on a little potty with Velcro. You can have little toys like this. You can have books. I like the book Everyone Poops. This is an old book, but I still like the video and book called Once Upon a Potty. There are a lot of preschool books about toileting. So you can imagine you could have a little toileting center for kids to practice. I've done some other things directly with the toilet too. Okay, let's say somebody likes Chase and you've got a little Chase stuffed animal. I'll use, those little ketchup or mustard dispensers. You can get them very cheaply at Walmart. I would hold that chase over the toilet and then, put that little condiment dispenser behind them and make them pee in the potty. And then you can clap for the little toy. Some kids like that, especially if it's a toy that they're strongly interested in or a character that they're strongly interested in. So, in your spare time, which we know you don't have, but some of you probably are really creative, so you could come up with some cool and fun toileting activities for children.
Yeah, and so thinking about structuring the environment, some more specific recommendations that we might have. Um, when you're first toileting, we want to associate toileting with one clear location. So that may be one specific bathroom in the school, in your classroom, a corner with a potty, because at first we're not trying to generalize to every bathroom. Um, you may, like Dr. Bundy said, schedule consistent toilet sits. So, using a visual timer in the classroom to show when it's going to be time for the next toilet sit. And while they're on the potty, you may, if they're not into the visual timer, another idea is to sit until their favorite song ends, even if it's just, a quick YouTube video song. We want to reduce as many distractions as we can from the bathroom. So removing toys, removing other peers. I know when I worked at the daycare, it was like all of the kids were in the bathroom at one time, which is difficult because they're all interested in each other. Is there a way to maybe just have one child at a time, as safely as possible? I know that's difficult though. And then having maybe a designated toy that they are allowed to have in the bathroom. Sometimes it's an iPad. I know that for kids, if that helps them regulate. Sometimes for kids, the iPad is distracting. So it really just depends on the situation. Provide physical supports for stability. So we really want in all learning situations, if possible, we know that kids learn better when their feet are flat on the floor, whether that's in a chair or on the toilet. So what can we do to help their feet be flat when they're learning to train or toilet train? You can use one of these little stools. I know my daycare had, toilets that were extremely low to the ground, so it wasn't really a problem. That's great, but that's not the situation for every kid. And then as much as you can, modify sensory input, preventing the toilet from flushing, maybe not having the sink running for other kids at the same time. Do they need to wear headphones? What can we do to make sure that those sensory aversions are managed? And that's going to, like I said, it's going to be different for every kid, and it's going to require different strategies and creative solutions too. Does anyone have a favorite sensory solution that they've used? I know you all have good ideas.
You can unmute to answer the question if you'd like to.
Haley, also in the chat, somebody wants that app that lets you put personalized photos in the potty
Ooh.
story. I bet they do.
Yes, I'll look it up when you're presenting again, Dr. Bundy.
Yeah, Phoebe, what do you do with Velcro? I use it for little picture schedules,
Oh yeah.
but I'm curious to know how you use it. I have another question too, Haley, before we go on to this slide.
Hmm.
Just based on our experiences and all the toddlers and preschoolers I see in diagnostic clinics, I'm curious. I would say for those 3 and 4 year olds, I would say maybe 1 out of 4 or maybe 0.5 out of 4 are trained. A lot of parents are afraid to send their kids to preschool because they're not toilet trained. I'm just curious for y'all, do you run into a lot of families that need your help with getting their child trained? I would like to know what you're encountering in your work in regard to toilet learning with kids with developmental delays.
When
Yeah.
I taught 3-year-olds, we had 13 kids and 9 of them were still in diapers at the beginning of the year.
Say that one more time.
When I taught preschool, I taught 3-year-olds and we had 13 kids total. 9 of them were in diapers at the beginning of the school year. So
Yeah,
we had 9 kids toilet training.
yeah, that sounds about right. And were parents working with you? Were you just kind of doing it during school? What did that look like?
I just kind of depended on the parent. Some of them would get mad that we hadn't fixed it and they weren't just going to the bathroom on their own when they got home. And then other
Yeah.
parents would help. So it's just kind of like, it was pretty much half and half. Some would help and some would be mad at us that we hadn't fixed their problem.
Yeah, so some families really need some serious education about what it's like to do toilet learning with their children who have developmental differences.
Yeah.
I would
I
say,
think
and also the reverse is true, to where sometimes they might be toilet trained at school and not at home. So they want your advice because they want to know what you're doing.
yeah.
But it's hard to replicate that setting sometimes.
Yeah, I find that to be true. You know, school is run in sort of a very routine way. There are so many nice transitions that you can weave toilet time into, and home may not have those. But don't you feel kind of excited when parents are like, "Hey, how'd you do that? I can't believe my child is toilet trained at school. Help me figure out how to do that at home." Yeah, just and behavioral folks would say that that's absolutely true. You know, the learning history is in place for toileting skills, for evoking toilet behaviors in school. That learning history is not in place at home, and it's not going to automatically generalize. So parents are really going to have to ask you, how did you do it? And they're going to have to do some of that stuff themselves. You know, again, even with typically developing kids, that may be true. For kids with developmental delays and differences, I would say it will be true. It will not automatically generalize. And in fact, for autism spectrum disorder, generalization is a challenge for all kinds of different skills, not just toilet learning.
Yeah.
I've learned over the years that I have been in childcare, consistency is everything. If you take them every 45 minutes to an hour, they will follow. You know, they learn to like they just know it's time to go. And
Yeah,
then when
almost
we
like you're
go,
conditioning their body,
yeah,
really, to that
we
routine.
we have like we call it our waiting room, like at a doctor's office. So we don't let the kids in the bathroom with the others, but they
Wow.
sit in the waiting room. So they kind of like are playing at the same time. They're waiting in the waiting room.
Yeah, cute. I love that setup. Thanks for sharing, everyone. That's so interesting. Yeah, so just thinking about a couple more sensory supports. Like I mentioned in the beginning, kids with autism have genuine like documented medical differences when it comes to toilet usage, urination, things like that. So just make sure that they are hydrated, so that they are able to practice that skill. They may need to be drinking a little bit more during potty training so that those toilet sits are beneficial. Um, During practice hours, we do want to avoid pull-ups or diapers as much as possible, just to, we know that those autistic kids or any kid in general, they're going to learn, through that cause effect. So, oh gosh, I feel that this underwear is wet. That's going to help them with recognize over time kind of those body differences and those body cues for toileting. Um, Sensory time before scheduled sits. We know too that the brain cannot learn if our bodies aren't regulated. So, maybe before we do the toilet sits, they do 10 jumps every time on the, mini trampoline, or if they have a favorite toy that they can kind of climb over in the classroom or a slide they can go down, maybe they do that 5 times to get their body, get some of their energy out and get their bodies calm. They may have a routine of blowing bubbles in the entryway to the bathroom. If they're very anxious in the bathroom, this is a great anxiety regulation tool because a child isn't going to, innately know how to take a deep breath and emotionally regulate, like an older child may be able to do. But we do know that physiologically, medically speaking, a child's body and anxiety will naturally calm down, by blowing air out and taking deep breaths. So, a way to kind of allow them to do that or facilitate that is blowing bubbles, in the doorway. For kids who have maybe more fine motor challenges that are preventing their toilet training, or um, it may not be even fine motor, it may just be the ability to attend to a task. Putting a mirror in front of the toilet allows them to see what they're physically doing, but also it can allow them to see the fine motor, skill that's involved in wiping. And so that's one of my favorite strategies that I've seen used in the clinical setting. And I think that kids kind of have fun looking at themselves, and just having something to do while they're sitting there, instead of just looking around the room. Use
Pushing
loose.
penis down too, is the skill you want, or you'll be peeing all over the room. The
Yeah,
mirror could help with that too.
yeah. Use loose fitting clothing. We don't want them to get stuck at the part where they're pulling down their pants because, they don't have the fine motor ability to unbutton or unzip. We only want to be working as much as possible on one skill at a time. And so unbuttoning is a great skill that we definitely should work on that, but we don't want it to necessarily be at the same time as toilet training if we
And
allowed
this
to.
is the time of life where no overalls need to come
Oh, yes.
to school. No
Definitely.
Oshkosh at that point.
Yeah, good point. And then one of my other favorite little sensory strategies is, again, we're talking about cause and effect. We want direct correlations. Nothing is more immediate than, if you get one of these little whizzy fizzy tablets, it's like an egg dye thing for Easter, I'm thinking of. Just put it in the toilet, and then as soon as they pee in the potty, it turns a different color, and it's kind of fun for them to see, oh, what color will I get this time? Um, or, using a Cheerio for boys to practice as targets could also kind of gamify it as well.
And I
I
would say
have a
you probably can't
question.
do this at school, but
Mm,
I like for kids to wear only underwear when they're in intense training periods because you can see when they're wet, immediately that way. Uh, so that might be something you could talk to parents about.
I think Margaret had a question.
Yes, can you hear me?
Hmm.
My question was if you have a child on the autism spectrum that is severe and the parents are dressing them in clothing purposefully so that they cannot remove the clothing to send them to school, what is your suggestion for going about toilet training in that situation?
Yeah, I think you'll have to have a team meeting with the family and see. It really is tough because the idea would be that they'll take everything off if they're in clothes that they can pull down.
Yeah, and we will talk about this later in the presentation too about steps in the toileting process, and maybe there's the step that they're doing independently at first isn't taking off the clothing. Maybe if it's the harm reductionist approach that we don't want them naked all school day and without clothes, maybe the teacher is taking down their clothing at first, and then that becomes a later goal once they're able to signal in some other way that they need to use the restroom. And then we work on that disrobing behavior.
I had
You
a
can talk to, you can get OT consultation too, because the question I always have is there any clothing that the person can tolerate and can
Yeah.
keep on? You can get ABA to help too. What's the function of that disrobing behavior and how can we work on that?
I think we had another question.
I was just going to add real quickly and throw in for our child care providers to remember that we cannot do food rewards while toileting. And from somebody whose mother specifically told her that I got toilet trained on M&Ms, that is a strategy a lot of people use in the home to use Skittles, M&Ms, Cheerios. You can still recommend that to parents. That is not a bad thing. What we have to keep in mind in the classroom is that because we have so many children and so much things going on that we don't want to give that constant flow of sugar rewards and food rewards. But I will tell you that as a past teacher, I did enjoy putting the Cheerios in the potty for the little boys to hit as targets. That was always a people pleaser.
I didn't know that about food rewards in the classroom, so thanks for telling us.
Yeah, just because I think that food rewards can be very powerful, especially for kids that have really significant cognitive deficits. So if you see where I may have written that, just ignore it. Just you know what your rules are and whether you can do that or not. But it might be something that parents could do at home to kickstart the behavior.
Yeah, and it helps a lot at home for kiddos who don't have that same routine all day long because Dr. Bundy's right. The routine of the day can help a lot at school, but at home it's kind of willy-nilly because everybody's getting home from their activities and it's bath time and bedtime routine and stuff. And so that Skittle or that M&M might be really exciting if I use the potty there.
So we talked about learning how to sit and practice sitting. The next step is to actually put something in the potty. And a lot of our kids on the autism spectrum can get stuck here. Now, I think Cheryl said, what'd you say, Cheryl? 40 every 45 minutes is your potty time. So, depends on what the child needs, what your policies are. I was saying about every 30 minutes, but hey, if 45 minutes works, if you can stay dry with 45 minutes, that's even better because you're not wasting as much time in the toilet, toileting area. We do I would say the number one barrier to toilet learning in the United States is pull-ups. I would say that's number one. Haley and I did a great clinic where we saw a lot of toddlers and preschoolers on the autism spectrum in South America. And we found that a greater percentage of children there, if you sort of match them for ability level and age, there's more training there. I think one of those reasons is because pull-ups are not available. I think another reason is just because parents really focus on it. Parents may have more time at home, schedules may be less busy, and they practice and focus and they get it done. It's pretty inspiring, really, to know that you can get it done. Some of the children, I would be like, really? There's no way in the US this particular child would be trained, but here they are showing up, and they know how to use a toilet. Put kids in underwear if you can stand to do it. It's terrible in the beginning to deal with accidents, but it pays off in the end. And I think pull-ups just extend toilet learning for years in some cases, maybe forever in some cases. As you know, you need a lot of goodwill, level of expense, underwear, and little pants and socks. If it's a bad enough accident, you can then throw those away and save yourself from that. And if it's just a pee accident, you can put them in a bag. I just think stress is lower for all of us if you've got lots of changes to put in. Y'all have this, your little kit, right, with wipes, plastic bags, gloves, your rewards. I've been known to stick the rewards down my shirt so I can get them out in seconds because I want that immediate connection. between success and getting that reward. In my case, a lot of times it's something in their mouth, getting a goldfish in their mouth. Little potties, this is more for parents than for you. But having a little potty wherever you go can be helpful. Many a parent has had a toddler using a little potty in their van, in their car, on the side of their road, in a parking lot, just because they can't wait long enough to get into a formal bathroom. Y'all, what do you think about sitting or standing for urination for toddler and preschool boys? I'm curious to know I have thoughts, but I want to know your thoughts.
I have two boys of my own. I think I always sat boys on the toilet backwards so they're not peeing on the staff member that's helping them. And then as they get older, they can stand up. That's just what I've done as a parent and as a child or preschool teacher, director, you know.
Okay, so you start with sitting. Anybody start with standing? I think starting with sitting is most typical, but does
I've
anybody?
tried starting with standing with a few of my boys. They did better straddling the toilet like a horse.
Yeah.
I also use popsicle sticks per each boy to push their penis down to show them how to push it down so that I'm not physically touching it.
Okay.
And then we throw the popsicle stick away afterwards just to kind of get them used to pushing it down,
Yeah.
be more
Good thinking.
successful.
I found that
I had a
there. Oh, go ahead.
Oh, it's because sorry, Dr. Bundy.
It's okay.
I had a little friend who also on the AS had on the spectrum. He was unsuccessful sitting, and we tried and tried and tried to sit because he was constipated, and mom and dad were worried about bowel movements. And as soon as we got him in a standing position and he was able to like take his clothes off. He was successful. And then we were able to do the sitting piece of it. But I think for like our typical developing boys, the sitting is always like the first um, like go around because they are worried about the bowel movement accidents. I think especially in childcare having to change the poopy accidents are always the harder
Yeah, I
piece.
think I think you're exactly right. I think most people start out with sitting, but I've had the same thing. I think sometimes our kiddos on the autism spectrum are having trouble connecting the feeling of a stream of, they're like, what am I supposed to be doing here? What is this?
Absolutely. Yeah,
I've
that's
had
exactly
you
what it
can't do
was.
this. Clearly, you can't do this in school. But I've had some success in rural areas with boys peeing on a tree, peeing in the backyard when dad and brother were peeing in the backyard, so that they were like, oh, that's what this is. Oh my gosh. Okay. And then maybe they could sit or maybe they would stand in the toilet to pee. So you kind of have to experiment a little. I think in autism, a key is how can I make that connection? Because a lot of our kids on the autism spectrum, they want a routine and they would like to repeat a routine, but we may have trouble showing them what routine we want. What is it that we're trying to get you to do? It can take a while to get that connection going. And if it takes a tree to get that connection, at home, then I'm all for it. Of course, then you've got to reteach, right? You can't pee on a tree at school. You can't pee on a tree after church.
I have to say, sometimes you just have to back up too. If they're not ready, then don't push it. Stop, wait a couple weeks, try it again.
Yeah, makes perfect sense. And I think it's good advice for parents, especially if a parent is getting very frustrated. That's always a sign to me of, why don't we, let's check on this again in a month. And I like the way you say in a couple of weeks as opposed to in a couple of years, which I see happen all the time. My child is 5. I've had no success. We're just going to get pull-ups. Even sometimes when I'm in my diagnostic clinics, this is terrible, but the social worker will say, hey, we think we can get you diapers for free through this program. And I'm like, don't, you know, I don't want you to get a year's supply of diapers. I want you to try before that. Okay, so I'm kind of excited about this, and I've got a couple of slides on this, and I want to see what you guys think about it. Now, you're educators as opposed to psychologists, so I don't know if you will know about this historic study. I was kind of raised on it in psychology in the 1990s and the early 90s. Fox and Azrin were really the first people to do research on getting somebody trained, somebody with, back then, the only people that got autism diagnoses were people with pretty significant characteristics of autism. So Fox and Azrin in the 70s, somewhere I've got on here the date, I think. Yeah, 1971. They had this intensive toilet training study that they did, and that was sort of the state of the art. But what you can see here is that I tried to mark out some of this intensive, dense kind of wording here, because really what Perez found out is, ooh, we don't have to do everything that Azrin and Fox told us to do. We can take some of their ideas, but not do everything, and it still works. Let's see, give me the next slide, and we'll see what Perez kept. So they said, yeah, the Azrin stuff worked, but you don't have to do all that. And we don't want to do all that because Azrin was doing overcorrection, practice, practice, practice. They were saying no, like when in their study, if people wet their pants, they'd say no, wet pants, take them to the potty. They'd have them sitting every 5 minutes. Now, it may be that there are some people with very, very significant cognitive delays that something like that intense situation might be necessary. That's not going to happen in early, that's not going to happen in preschool and toddler years. Uh, that might be something that would happen for adults that were age 20 before anybody really tried. For your average kiddo, even your average kiddo on the autism spectrum, Perez found that what works is about a 30-minute sit schedule, wearing underwear instead of diapers and pull-ups, big rewards for successful potty use, something very desirable, very motivating, no attention for accidents, just calm and quiet cleaning up. And he wanted a combination of social rewards, good pooping in the potty, hooray! And tangible rewards like a special song, small snack. You guys can't do that. But, at home, I would have it be something forbidden. You can never have Doritos unless you poop in the potty. Then you can
You,
have a big Dorito. 5 minutes
you
on
can
the iPad, a little menu of things. If you've got kids that get sick of the same prize, what I've got down there is what snack, game, or iPad. So this is Perez's work. These elements were successfully able to train most of their little kiddos on the autism spectrum. So thank you, Perez. And that's a pretty recent study, 2020, for checking on that historic result to find out if all those things still were needed. And it turned out that they weren't. And that's good for us.
we have a potty chart too. So if they go in the potty, then they get a sticker. And it's on the bathroom door. So they get to see that. And then like say at
Perfect.
the end of the month they get to take it home.
Nice. And kiddos on the autism spectrum, some with pretty intense autism may not notice that, but some may really like that. And you could pick your stickers. Your stickers could be couture, right? If they're really into Blippy or whatever they're really into, you might be able to motivate them by choosing your stickers to match that favorite interest.
I also had a basket of fun, like sound making machines or like buttons that they get to ring every time they peed in the potty. Because I had a
Perfect.
kid who was on the spectrum who really enjoyed beeping sounds. And so I had a special machine that made a beep sound. So he got to press it every time he peed.
So
And he was potty
creative.
trained in like 2 weeks. It was amazing.
Yeah, you created like a potty party
Basically. And then we have
with
a
the
potty
noise.
dance, and all of our 2-year-olds would potty, like have a potty dance. Like we'd freeze and dance every time someone peed. We
That
made it
is
a fall
so
celebration
cute.
as a class.
Really creative. I love it. Really
See,
great.
you did the assessment phase and found out what the kid's favorite reward was before you started. So that's why it was
Hmm.
successful for you, because for me, that would not be a reinforcer. I don't want to hear a
Yeah.
strange sound, but for that kid, it was. So good on you, Courtney.
Yeah, you did a preference assessment. That's
Yeah.
great.
Yeah, I had some kids who didn't like that, so I had a special thing for each kid in my basket, and they would get to pull it out whenever they got to pee. So that way each kid had a fun thing to do every time they peed. And then if they pooped, we made an even a bigger deal about it because pooping is the hardest one to get to go in
That's
the
right.
potty.
That's exactly right. In your spare time, if you still do you still have that basket?
I actually had to recreate it because I'm a kindergarten teacher now in our daycare. So I have kids who are on the spectrum now. So we do something kind of same, but I have it taped on the wall. So that way they can just
If you
snack it.
do it, and this is true for anybody, please send me your great images, the things that you do that are working. And the next time I give this presentation, I'll include your pictures in there and I'll give you credit. Yeah, great ideas.
Yeah, if you
So,
throw my
okay,
email
let's
down
see
there,
if
I
anybody
can
gets
email
my
it.
joke here. But get that?
Oh.
BUTT. Okay, but will toilet skills happen organically and easily for most autistic children? Generally, no. So those parents that are thinking, hey, how come you haven't fixed the toileting stuff at home? I think you need to let them know that they're going to have to work. Probably there's going to be some delays, and even to get things taken care of, by that 5 year, let's say we go 2 years delayed and we're at five, it's still probably going to require some patience, but we think it's worth it. There are years of payoff for that intense work. This
Yeah.
is, the classic little PECS picture routine. It may need to be simpler for some kids. You may have photos for some kids. It may need to be a photo of the child themselves. Obviously, you want to include a picture of them with their pants down, but you could include a picture of them sitting on the toilet. And they can pull those off as they finish them if that's fun. I like to use Velcro. If you have this on an iPad, maybe, I don't know how to do this technically, but probably some of you do. You push the picture and it goes away, or it makes a cute little sound, some little way to help them see that they've finished each of these little pictured steps. One of you said
One said
this.
it earlier.
Yeah, somebody stole my thunder with this slide. And
I
y'all
know.
y'all know this. And it's true with everything for your kids, right? It's not just toileting. And that's why they get trained more quickly at school generally than at home, because you all are very consistent and routine bound, and your kids thrive on that. So once you get a functional routine for toileting, stick to it, share it with the family, communicate with everybody so that you can all do it. Communicate with choose your potty language. And you might, when you're doing potty language, you might think about the fact that for some kids with more intense delays, they may use that language all their life. So you may not want it to be very juvenile, right? If it's going to be forever language. So think about that. And then you hope, you may start out with time training, but you hope eventually the child will tell you when they have to go, and you can figure out what that's going to be. Is it going to be a photo? Is it going to be a roll of toilet paper? Is it going to be, a sign asking to go potty? Is it going to be the word toilet or bathroom? Figure it out as a team and then stick to it.
I would say on this one, with the potty language, I've had some cultural um,
Hmm.
feedback from families. Some families do not want their child to use the word potty, or they don't want their child to say, I have to pee. They really want them to learn to say, time for the bathroom, or I have to use the toilet. So sometimes you might have parents give feedback and just say, I appreciate that you're doing this, but in our house, we don't say it this way, because it can be a little more upsetting for some families, and other families, just if the child will use the toilet, they don't care what you call it.
Yeah, that's how I feel. You can say anything, just keep your clothes dry. You could do a little, if you're going to start a toilet learning program with a child, you could have a little 5 question survey for parents, right? This could be included on it. What would you like? How would you like for your child to ask for the toilet? Or we're thinking about using this picture. Is this okay? Are photos okay?
So when we're thinking about theories of learning, this is kind of an advanced skill. So, take what resonates with you, leave what doesn't, but we'll get into some of the nitty-gritty of the learning theory. But when we're thinking about forward chaining and teaching a new skill, so this would be that the child completes the first step of the potty routine. So it may be as simple as They open the door to the bathroom and walk in and kind of communicate that they have to go to the toilet. And as they're learning the routine, the childcare provider or the teacher will give heavy prompts for each small task in the routine, and they'll kind of scaffold those steps for the child. And that's great, and that works for some children. But backwards training, actually, a lot of research shows that this is great for autistic kids when they're learning a new skill. So, the way that this works is that the caregiver or the teacher does most of the first steps of the routine. So, you're going to be prompting the child, sit on the toilet. You might pull their pants down for them, sit them on the toilet. But as they're learning the routine, they're going to have independence in the last step of the routine. And you'll praise and reinforce that last step. And then as they master that step, so they don't need any prompting, they don't need hand over hand instruction, then they'll do the next last step and the next one until they're doing the whole routine themselves. So it might start, and the only thing they're doing independently is at the end of that routine is that they're flushing the toilet without a prompt. But then maybe they're wiping independently or pulling their pants down independently, but we're going backwards. And so this kind of, research just kind of showed that this just increases motivation because it's very quick for them to get rewards and it feels like, wow, I escaped this task because I flushed the toilet. And that's reinforcing and makes it less aversive to learn all of the smaller parts of the task. And you all know this. This is your bread and butter, but we want you to, just as a reminder, always using positive reinforcement, labeled praise. It's the strongest motivator for a lot of our kids, or some of our kids, I should say. But, make sure you're telling them exactly what they're doing good. Well, good pants down, or if they don't have that receptive language, just clapping when they pull down their pants. Give one short instruction at a time and avoid negatives. A lot of our kids with disabilities have a lot of language delays. And so we could be telling them very eloquently how to use the bathroom, but it's just not going to be effective. So pull pants down or pull down pants rather than don't sit with your pants on. We want to be telling the kid what we want to see rather than what we don't want to see. This consider small immediate rewards. We've talked about this at length. And then, as Dr. Bundy previously mentioned, the Perez study, avoiding punishment for unsuccessful trials can actually increase toileting anxiety, increase toileting aversions. So if there is an accident or an unsuccessful toileting trial, just modeling calmness in yourself. I know it's very frustrating when you have 20 kids running around and now you have a mess to clean up. Trust me, I get it. I've been there. And it's very difficult, but as much best as you can, try to avoid any punishment for those times.
Hi, Haley. My name is Yolanda. I have a question.
Yeah.
So, for each time a child goes to the potty, do you clean this, sanitize the toilet each time? Because I have one that you sit on top of a toilet, and the kids are really scared of it. They're scared of the big one,
Yeah.
and they're getting better at using the little one that they step up on and sit on it. But
Mhm.
if I put them in line and say, okay, you first, and then you second, and of course they have to wash their hands and whatnot. Do you spray it every time and clean the toilet to sanitize it because they put their hands on the handrail and everything? And the
Mhm.
little boy, I have all boys,
Oh
and
gosh,
so
that's
of
a
course
lot.
they touch the wee wee and they're
Mhm.
pointing it down, and so
Yeah.
I'm looking at that and say, okay, let me get a soap dispenser that doesn't have a touch to it
No.
anymore. So what do you do in terms of the handrails and the seat that they sit on?
Well, let,
When
let
I
me
go to
offer a
the
little bit of a
we
licensing
do that.
perspective on this, and then Haley and Dr. Bundy can go for best
Great.
practice about that. If you are using like an insert that goes on top of the toilet, like those little tiny ones that are plastic, or if you have a potty seat that are plastic and porous and can be like soaked up into stuff, then you have to clean that every time. If you're using the regular type of toilet, then you have to clean the toilet, a couple times throughout the day, but licensing would not require you to have to do that multiple times.
I was just gonna say that I was gonna offer my perspective of how my daycare did it, but I'm glad that we have the official policies here.
I
Oh no, I think you muted on accident. We can't hear you, Yolanda.
can you hear me now?
Now we
Yes.
can.
Oh, I am constantly cleaning all the
Yes.
time, everything.
Well, good. I'm glad your kids have a good, clean, safe environment.
Mm.
Yeah, and so kind of this goes with the backwards chaining that I was talking about earlier, but as kids learn the toileting routine, we want to prompt fade or fade out their prompts. So this is kind of just the gradual reduction of assistance as a child is learning a new skill. So we want the child to be as independent as possible in toileting, and reduce the amount of help that they need. So, on day one, you might be using hand over hand, if your center allows hand over hand assistance to teach them the task. Then you may be using light touches. If we're thinking about the pants pulling down routine, light touch their waist to remind them to pull their pants down. Then you may be just pointing to their waistband to remind them to pull down their pants, or pull up their pants. Then you might be using just a simple verbal cue as a reminder of like, hey, let's keep this routine going. And this may be longer than 10 days, of course. This
Yeah,
may be
that's what I was going to say. For some kids, this could be
yeah,
10 days. For some kids, it could be 10 weeks, and that's
yeah.
okay.
But we just don't want to add to the prompt as the child is mastering the routine. So if they are mastering the skill, we want to use as little of prompts as possible, as little hand over hand as possible, just to, foster that independence for them.
What research
Good.
shows is that children with developmental delays and children on the autism spectrum can become prompt dependent pretty easily. So neurotypical kids, a lot of times they don't, they're going to stop you from over prompting them. Me do it, I can do it. And what we find is that, especially with autism, sometimes that just doesn't happen. So it seems like the teacher is prompting for too long or the parent. But what's really happening is the teacher or the parent isn't getting that feedback. It just doesn't always happen with these kids. So you may have to give yourself the feedback. Ooh, how much am I still prompting? I wonder if I could pull back my prompting a little.
Could I add something?
Yeah.
Um, Also, I just wanted to remind everyone that when you are prompting, to give processing time so that the child can respond before you assume that it is a fail and go on with the task.
Mhm. That's a good reminder. You're right. We do need to be extra patient with our autistic kiddos. Remember that they have, longer processing times than their peers. Good reminder.
And any children with disability may have reasons for longer processing.
Yeah.
Actually, I had an accommodation on my daughter's IEP. She has cerebral palsy, and she needed it when she was 3. Honestly, she needed it last year when she was 17. She can't go to the bathroom as quickly as other kids, right? Takes her a long time to get her pants down. Takes her a long time to get her hand to open, right, to be able to assist. So for physical purposes, and honestly, I think for cognitive processing too, she really cannot be rushed. So it was let's just say it was a soapbox issue of mine for many years to try to get people to allow her enough time. At one point, I actually had her getting to use an individual bathroom because there seemed to be no way for her to get enough time. Right, because everybody's trying to get in there. It's a limited amount of time. Anyway, I appreciate your comment. So I've got some more stuff here about visually supported routines. You can use an AAC device. You can use objects, pictures, or words, depending on what the child understands. Some children may need to be shown what to do. Haley and I were talking about it today. I've had many kids where I follow them around with a little potty. Again, you can't do this in daycare, but I could do it in residential or individual care. So they're naked and I'm following them around with a potty so they can see, look, this is where this goes. I want you to put this in here because to them, where it goes is the diaper. That's where it's always gone. They need to see that I want them to go somewhere. I want it to go somewhere else now. They're not going to figure it out unless they're shown. somebody was talking about the cute little sticker chart, adorable, or a checklist. Some kids really might like to do that. You can use, when you all make your toilet learning centers, you could have pictures of bathrooms. You could get parents to send in pictures of their bathrooms at home. That might be kind of cool to see all the different bathrooms that belong. You can just imagine the kids saying, "This is mine. This is mine," so they can get generalization. Um, if you've got a kid that finds the bathroom experience aversive, you might be able to entice them into that room if you've got some images that fit the things that they like. Ooh, this is going to be a fun chat thing. Put in the chat the hottest interests right now of your toddler preschool kids. I can't wait to see what the most popular stuff is. Bluey. Who's going on the bathrooms for
Oh,
motivation? Bluey,
Can you hear me?
yeah.
Spider-Man.
Um, I had a question. So I'm a teacher and I've taught children of early Head Start and Head Start, but I'm also a mother of a child with autism, level 3 nonverbal. And I'm struggling like implementing the same things I do at work that I do at home with him because cognitively he doesn't comprehend what I'm doing. And it seems like I'm scared I'm traumatizing him. So I back up. Every time I make progress, I back out because it's like he's not understanding. I've tried visual cues, I've tried like the Velcro cards and stuff. I just don't know how to approach it whenever he's 4 years old, but he's cognitively not at that level. Do you have
Yeah,
tips
I
for
would
that?
hit it in a bunch of different ways. Is there anybody that he can watch toilet? So that's one
Yeah,
thing.
and so I sent him with his father, like, and I've learned that like he prefers standing up just because of how he goes in the shower every time we put him in there. So I've even tried to use
Ooh, bring
like
that
a
little potty chair into the shower. You might be able to catch the pee in that while he's in there, since that's the time he goes.
That's what I've been trying to recently because like cognitively I can tell that he's even when I give him verbal like I speak him like third person like telling him what I'm doing it's not registering.
Yeah, so
So
for him, it's not going to be words that train him. It's going to be routine. So you've got to find a way to get pee in the potty. Now, he may be one that you give him a big Sprite. It's his lucky day. Take everything off below the waist, and have him practice going to the potty a bunch of times. Follow him around with the potty. I'd be stuck to him like glue.
yeah.
Give him a big gulp and try to catch that pee in the potty, because he's going to have to experience it. You can't
Yes.
verbally explain it to him. It's
Yeah.
going to have to become a routine. And a little sitting routine could work if you're pushing fluids. You
Mhm.
might have to spend a weekend with some big gulps,
Yeah. He shows
and see if
visual
you
cues
can.
like he wakes up dry and stuff. So he's showing those cues that he's
Yeah,
ready.
his body's ready. We
But
just got to
I
get him
just
understanding the routine.
yeah. Okay, thank you so
It
much.
can be done. He can learn.
Mhm.
It's just going to have to be through routine and through demonstration. Um,
Repetition.
yeah, don't give up. Ooh, what's the big shirt method? Let's find out about this from Catherine.
Also, one thing I want to add, Dr. Bunny, really quickly is we know that for all kids with anxiety, parent anxiety is actually the biggest barrier to facing their fear. So, fleeing fights or feeds fear. Fighting, what is it? Facing fights fear.
Yeah,
So,
facing fear fights fear. So
yeah.
just more practice, more
Yeah.
experience in the bathroom, more touching the toilet, more sitting on the toilet, all those things.
The
Keep
less
doing
he
it.
can escape the task, the better. And sometimes it's us as parents or teachers that want to escape the task because we're tired of the routine and we want to go to bed or whatever it is. But as much as you can push through your own anxiety about it, the better. And I hope, I highly doubt you're traumatizing him. This is a skill that's going to be really important for him in his life. And so you don't seem like someone who would be doing that from the limited time I've met you, but keep going, Mom.
Yeah, just,
Good job.
again, new things are scary. So he
Yeah.
may be meh, but he'll be okay.
Yeah.
Um, so I see the big shirt method is sort of the idea that I was talking about, that, you could have some little potty training periods where he's got a big shirt,
Oh.
but nothing on the bottom. So you can catch that pee and get it to go where you eventually want it to go. So he can learn that, so he can see that routine. Dang, I didn't know that there was a name for that, Catherine. I remember that.
Here's
Sometimes
some
we
examples. Go ahead,
we
Kat.
had a in another small group setting, I was able to take I was able to put a skirt on a little boy
and not have the pull up on underneath so that he was covered.
Yeah,
And
covered, but
we
immediate access. Because that's the other
yes.
thing with these kids that are having trouble. You really got to move fast. You got to move
Oh yeah.
fast to get to pee in the potty, and you got to, even if it's just the last drop, and you got to move fast to get that again. If you're at home, I'm like lightning to get that food in their mouth because I want to make that connection. Oh my gosh, this went into that, and then food comes. Even if they don't understand why, that will still increase peeing in the potty if it's followed by. And, it should be a very desirable food that they usually don't get. That may be the connection that needs to happen at home before this little guy can start doing it at school. Look at all this cute stuff. I love these, Haley.
Yeah, these are that's my favorite slide. Here's just some examples of some visual supports that you can use. Just talking about, so we all know, pictures, use the Velcro. It sounds like you all are doing that. Great job. But sometimes people forget that, some kids have significant cognitive delays. And so it's actually a really advanced cognitive skill for some of our kids to be able to generalize a picture of a toilet and a real toilet or something that's associated with the bathroom routine to a cartoon picture. So, one, we could use real pictures of the actual toilet that's in the classroom, but we could also use objects for communication. So, the child may actually have, a board that shows a real roll of toilet paper or,
Or
something.
wipes.
Yeah, or wipes, something that's really tangible that they bring to the teacher when they have to go to the bathroom, because they may just not be understanding those pictures yet. And so that's something that you can implement. We mentioned this earlier, keep putting their interest in the classroom, doing a first then chart so they can see their prize options. Again, this is a bad example because these are kind of cartoon pictures, but you could have real pictures of their real prizes. And then this is called like a power card. You can use their interest as a motivator. You could say, well, Pikachu goes on the potty, so you can go on the potty too. Just incorporating their interests where you can and making it fun.
Looks like Pikachu may be constipated. Look at his little expression on there.
Yeah, poor
Poor
buddy.
Pikachu. I'd like to
Yeah.
see a smile on your face, Pikachu. Oh, that is really cute, Courtney. Gosh, so creative. You could
It
have
is,
a
yeah.
little switch that says potty or bathroom too, right? One of the little button pushing switches. So these are common barriers that I wanted to address real quickly. I know we're running out of time, but I think we'll just get through most of our slides here. So for kids that really don't seem to like to sit on a toilet, that 5 second sitting goal at first may be 5 seconds tolerating being in the bathroom, 5 seconds touching the toilet, 5 seconds, staying in the bathroom during a common poop time with their toilet, with their diaper on, 5 seconds sitting on the toilet with their diaper on. My son is a registered behavior tech. He's got a little kid that he wears a diaper with a hole cut out of the bottom at the little butt area. So he still gets to keep his diaper on, but he also sits on the potty and poop can come out because he's been really afraid of letting go of that diaper. So they've got a step-by-step thing, and his current situation is a diaper with a hole cut out. My son came home and he was like, "It's the weirdest program," and I was like, "Ooh, I think they might have gotten that idea from me." I've used that a lot. Earplugs or headphones if they're afraid of flushing. You can put let's try not to train kids on an auto flush toilet. That's such intense stimuli. Hopefully, you don't have loud toilets in your classroom. Absolutely. Yeah. A book is a great idea. I really like it. And it could even be a potty book, right? I like that better than an iPad because you get kids started on an iPad in the bathroom. They're not going to want to give it up. Then you're having a tantrum when you leave. But a book is not as quite as exciting. So, but it may be a routine for them. Sensory play, if they're trying to get into the toilet water or the sink water, you can get, sometimes I've had one, but I don't have it with me here. The little plastic toys with fluid so they can hold a little liquid toy. Oh, yeah, poppets. Great idea, Courtney. I love that. They can be cleaned easily too, so I like that.
Mhm.
Cleaning resistance, if it's a scent, get an unscented wipe. Get a super silky wipe, right? Get a wipe warmer. I'll do anything to get kids to let me wipe their bottoms. For kids that are nervous, gradually remove those diapers. Obviously, we've got a lot of constipation that we see in our kiddos on the autism spectrum. They're going to need to consult with a pediatrician, maybe even a GI doctor, to get their poops to a consistency that you can work with them on toileting. These kids are easily conditioned. They get scared and nervous easily. It might be one painful constipated poop, right? And then they're afraid of the toilet. So we have to work with them on that.
Yeah, and so thinking about communication, Dr. Bundy kind of talked about this earlier, but just planning how the child's going to communicate, whether it's bringing the toilet paper roll. And a lot of kids we know will use their AAC devices. And just a quick note on Actually, I think that might be on the next page. But, just allow all the buttons that they need for their bathroom routine to be easily available. Maybe when you're working on potty training, that bathroom page is easily pulled up for them to access so that we're not having communication barriers and bathroom barriers at the same time and kind of working on one skill. And then making sure that we're communicating with parents about, are we using AAC at home during bathroom times, or are you using some kind of other picture communication? Or schedules to make sure that it's consistent across environments. And so maybe it wasn't on the next slide. I was going to also add just to make sure that you have the anatomically correct terms on AAC so that the child has the right to communicate just like their neurotypical peers would. And it's a safety tool, as we'll talk about. So, this is kind of the sad part of our presentation. So if anyone needs to take a break, we totally understand. But, we do know that children with disabilities are about 2 to 4 times more likely to experience violence, sexual violence than their peers without disabilities, kind of just depending on their disability and the study population. But the good news is that we know that as kids become more independent in toileting, they're less at risk than children who are dependent for toileting needs. So they're going to spend less time requiring that intimate physical assistance as they age. They're going to have fewer adults who need to be involved in their personal hygiene routines. They're going to have greater bodily autonomy and access to privacy. They, may learn through the toileting routine as well to communicate their needs and boundaries. And they can gain confidence in advocating for themselves in, personal subjects.
Yeah, my goal for the hard work that you're putting in and trying to get these kids trained is that there'll be teenagers and adults who can close and lock the door when they need to use the bathroom. That is my dearest hope, because that vulnerability to abuse for some of our folks continues even into adulthood. And you are a vital part of helping prevent that by teaching kids to to be as independent as they can in their toileting routines. Just some more independence promotion. You know how this happens organically because you've got a sense for the kids under your care and who really needs to go. Who do you need to take every 20 to 30 minutes or even more often? Who maybe only needs to go every hour because they're usually dry, right? So you want to slowly increase the amount of times between the bathroom trips. Now, you know how to do this. Use behavior as a request. You can prompt them to say bathroom, but if a child's pulling their pants, doing the potty dance, holding their crotch area, right, all those are cues for you to get that child to the bathroom. And you want to teach the bathroom locations in as many environments as possible and talk to families about doing this. I don't know about y'all, all of my main places that I go, I know where the bathrooms are. Are you like that? Like, do you know where the bathrooms are in Walmart, Kroger, the park, your favorite, shopping place? I don't know. Even on a plane, right? You have an idea about where the bathroom will probably be located. When I get on a plane and I get my seat, I'm like, okay, where's the bathroom, right? So I need that, and we want to teach that to our kids too, especially in their familiar places. Something that you probably do, which helps you have success, is pair your bathroom trips with your daily routine. It's lunchtime, go potty and wash hands. It's almost recess time, go potty. You're back from recess, go potty, right? And if they're at home, it's time for bed, go potty. So getting into the routine where they know that they're going to be asked to go at certain times and the whole class is going to go. That's a very helpful thing that people often don't have at home, but you have in your classrooms.
Oh, here we go. Here's my slide about anatomically
Um,
correct terms on the AAC. Yes. So we want kids to have access to that language just as because it allows them to be able to report things that may be happening to them effectively. Um, and if it's appropriate, you can create a visual chart. This was more so for parents at home, but maybe you could do it at school too. Create a visual chart of individuals who are allowed in the bathroom with the child. So this could also be on their AAC kind of bathroom tab, as a reminder, only teacher, only Courtney, only Margaret is allowed in the bathroom. And they can see a picture of those faces. And that allows them to, if they associate the bathroom with something bad that's happened to them, they can maybe press that key on their AAC to attempt to report that individual. When possible, we know that this is not always possible. Tantrums are going to happen. Kids are not going to like certain parts of the bathroom routine. But if a child's mastered a step and they're saying stop, accept that withdrawn consent as much as you possibly can, as it's safe and able, just to teach them some of those early consent skills. And then, of course, in the classroom, when we're thinking about SEL, emotional learning, teach about safe and unsafe touches in general. Of course, children may not completely grasp this concept, but they should still have access to this information, assuming competence, to help them understand what is safe and what is not. And that may be something that therapy does with them as well, too. Some other considerations, when I was working in the daycare and we were doing, bathroom time, we always had several staff members scheduled in the room at each time. So if your center allows this, just having multiple eyes on the child to make sure that they're safe. Explain each step. If you're going to touch the child, give them some kind of cue that they might understand before touching them. Encourage as much independence as possible, which we talked about. Respect privacy when possible. I like that one of our teachers in the room said that they have only one kid in the bathroom at a time. That was not my experience. So I love that. And more centers need that. Um, just to teach that, yeah, the bathroom's a private place and we should generalize this throughout our life. Um, Monitor staff frustration. I think most abuse or inappropriate touches happen because adults are feeling frustrated and sometimes rightfully so. But if we're noticing those increasing frustrations, take breaks, offer to support, your coworker, so that we're not taking it out on the child or the adult individual, whoever it may be. Um, and then monitor those children for unexplained injuries in their private area or their legs, or changes in hygiene. We know that, after assault or abuse, a lot of children's hygiene practices may change. So that may be a warning sign that, hey, we need to look into this a little bit more. And then also just monitor all other social emotional behaviors, that occur around bathroom time. So maybe the child was mostly, free of anxiety when entering the bathroom, but suddenly there's a lot of distress and tantruming when entering the bathroom. That might be something that we just monitor and think about to make sure that the bathroom routine is staying safe.
Almost done, but boy, I really wanted to get to this top thing. Y'all probably know this, but nighttime wetting is not abnormal. In fact, you can't even give bedwetting or nocturnal enuresis as a diagnosis until age 7. So this is something that you can educate families about. Some kids do become dry overnight in the toddler and preschool years, but many do not. And if you've got a child that's still wetting at night, of course, they can wear a pull-up only at night, right? When this is happening, they're not awake to practice toilet training. So I certainly think it's acceptable to wear a pull-up. If you've got a child that's trying to give up pull-ups at night, of course, you're going to have them try to go to the bathroom before they go to bed. And I like for parents, okay, so let's say the child goes to bed at 8. I like for parents to get a non-pull-up wearing child up again at 11 or 10 before they go to bed and have them pee again to try to help them make it through the night. I've had some pretty good success with, say, 8, 10, 11-year-olds with that strategy, or in some cases, even 16-year-olds. Most kids have outgrown bedwetting by age 16. Most outgrow it by age 6 or 7. There's another set that don't outgrow it until 12. and still another set, if you can believe it, that will still nighttime urinate until they're 16. And then by 16, pretty much everybody has it done. And by the way, this runs in families. So, I think sometimes people have had some shame about it themselves, so they don't want to talk about what their experience is. But if you've got a parent or an uncle or an aunt who was a more prolonged bedwetter, then that may just be normal for that child. They don't concentrate their urine at night from a genetic perspective, and it's going to take them longer to stay dry at night, but they will master it. There's a medication called desmopressin that families can ask their pediatricians about, and it's a great assist to help kids concentrate their urine overnight. It's great for overnight camps, staying overnight with a friend. It's probably not a nightly medicine, but it's a great tool for kids that tend to wet the bed to help them get through a special nighttime. So I recommend it. There's a wet stop alarm that some people have had some success with. It buzzes and wakes the child up when they wet the bed. I haven't had a lot of success with that one myself, but some people do like it. A couple of other things, you all already mentioned this. Usually you get urine training first, and then you work on bowel training after that. You guys have some suggestions for wipes. And I think we've got one last slide. I hope it's praising you for your part in really positive. You may have actually the most important, the most critical role for lots of families and lots of kids in toileting practice, and we celebrate you for that. We really appreciate what you're doing. Thanks for all your input.
Yeah. You all were such a fun group. I learned a lot of strategies. I'm excited about the popsicle stick strategy. I'm going to use that with some of my patients. So, well, not me personally, but I'll recommend it to the families. But yeah, thanks for coming tonight. And if you have any questions, feel free to email us or ask them.
All right, I am going to get ready. I'm pulling up the link for our survey. Before you get off, you need to complete the survey because that's what's going to verify that you attended the training and give us the information we need to enter everything into ECE TRIS. So I'm going to get that now and put it in the chat. If you are watching in a group, I know several of you are like 5 of you at one location, that kind of thing. You will each need to complete the survey. Because you'll each want to individually get credit. So don't just do one person if there's multiple people in a location. So let's see here. All right, I'm putting this in the chat. So go down to your little chat box and we will soon as you open the survey up, you're done with the training here. Just make sure that you complete the survey this evening so that we can start getting credit raised. April, I see you have a question.
It is a very specific to my center situation, just in terms of our geography. So it's not something that everybody has to wait for if they don't want to, but I would love a chance to get their perspective on it.
Sure, ask away, and I'm glad Sarah's here too, because it may be something that we need her advice on.
Okay. So at my center, we do not have any rules about potty training. In terms of like a kid has to be potty trained by a certain age to move to a certain class. We're super relaxed about all of that. And we just assure our families that, we rarely send them to kindergarten and not potty trained. But our unique situation is that we have a beautiful all natural playground that is across a parking lot and about a football field's walk from the closest bathroom. So the only rule that we really have.
How do I get back up there to check the others?
Patricia, you might just want to mute yourself. If you're not April, mute yourselves. I know y'all are struggling to get to your surveys, and I want you to get there. So April, you may have more to say, but
so it's about a football field walk across a parking lot to the closest bathroom. So the only rule that we have is that we say to our families, we ask for pull-ups until they are confidently potty trained for playground time, because if not, it is a really long, uncomfortable walk in the cold or walk in the heat with wet pants. And we have one family this year that is really pushing back against that on us, and we agree with her that her 4 year old who's still potty training and struggling with some things. Ideally, we want him in underwear too, but that is the one time of day that we feel like it is for his health, safety, and comfort to be in pull-ups. And so I was just curious, as experts on potty training, if you all have any perspective on that to share.
Well, I don't think I'm an expert. I think you got all the experts here in the participant list, but I hope I have some ideas. I'll tell you what I've seen people do for playground. Maybe you'll think it's crazy, but I have seen it done. You know those little portable screens, portable dressing screens? I don't know if that's the proper name for that. Like a portable dressing room. I've seen people do toileting with portable potty chairs and those little dressing screens. Now, you're not going to be able to have 20 kids. We just talked about how to clean potty chair seats, right? You're going to run into problems with that. But you could have that as an option if you have two or three inexpensive potty chairs and a little dressing screen. I don't know. I'm actually Googling it. Looks like Wayfair has one for $60. Here's one. Yeah, Wayfair has one for $50. So it's a bit of an investment, but it's not atrociously expensive. You remember how back in the day they used to have those little portable dressing rooms for people to put on, that really some places still do, for people to put on their bathing suits? You could create something like that for that child to use the potty, or for kids that need to go. And of course, you'd have to say to kids, this is just for emergencies. We want you to use the school potty. But if somebody has an emergency, we'll have a potty in here. Now, you know what's going to happen the first day, right? Everyone's going to want to try that because it's going to be exciting. I don't know how you'll manage that. But anyway, just a thought. Haley, do you have a better idea? I kind of like the idea of a little special potty area on their playground.
Yeah, I don't know. You may not like my answer and you don't have to take it if it doesn't work for your center, but I kind of think that, well, being wet is kind of an uncomfortable, thing, and that may kind of encourage the potty routine over time. We don't always want to avoid things that are uncomfortable for our kids, even though, maybe from a state regs perspective, that may be different, but from a psychological perspective, that's a powerful natural consequence to be wet on the playground. Um,
I really do wish that I wish that it mattered to him. It doesn't.
okay.
We have to notice that he's wet and then make him come in. He won't. It's not something that has been uncomfortable, which is why we went back to, we really need the pull-ups on the playground. We tried it without them. He's not telling us he has to go. He's not telling us he's wet. We don't know how long he's been wet when by the time we recognize it. So anyway, when I saw this training, I thought it would be an interesting
Yeah,
question.
you might be able to, of course, I'm sure you're trying to get him to pee before, use the
Yep.
potty before playground. You could take my little screen idea, talk about commitment, right? You could take a little portable restroom out there, and you could have him do that in the middle of playground time, and then have him try again when he comes in. And I know when kids are playing on the playground, it's sort of the last time they're going to feel wet and want to stop and use the bathroom because they're having a lot of fun. But you could reward him for trying one time during outdoor time and see if that gets you any farther with him.
Mhm.
Yeah, April, I would say in my past experience that the playground is just typically the highest rate of potty accidents, just
Yeah.
because
It's
nobody
like
wants to
asking,
lose.
it's begging for potty accidents because it's
Yeah.
super fun and you're moving your body a lot.
And you don't want to lose your playground time to go inside and go to the bathroom.
That's
So
right.
that's such a drag, but it is really challenging, particularly if you need an adult to take somebody inside, and it affects your ratios that way.
Yeah. Thank you for working so hard on this with him. And I have to say, it's a pain to have a parent being stubborn, but it's also kind of cool that they really want to work on it. I don't see enough parents that are seriously committed to their kids' toilet learning. So I'm glad they care at least.
April, if you don't mind me interjecting. Also, hi, good to see you again, April. Is the parents pushing back because of purchasing the pull-ups? Is that one of the restraints? No, it is just because it's It like a stigma socially?
Yeah, well, they are just
Okay.
very frustrated that he hasn't mastered this yet, and are, really worried. And we are not, we've told them we've had plenty of kids who are 4, not potty trained. They get it by the time they go to kindergarten. We're not worried. We just want him. He's also a kid who really needs his movement time, for lots of sensory reasons. And so when he spends all of his playground time in the bathroom, changing clothes, it can be really frustrating for all of us. So anyway, it's just a really unique challenge. Most childcare centers go out a door and to the playground and come right back in that door, and there's a bathroom. We have a football field to walk plus a parking lot to cross. So
The other thing I know, I'm sure some people are gone and that's just fine, but I think you're making me think of an important point, which is toilet learning can be really emotional for people, for the children, for teachers, and especially for parents. There can be a lot of tension and aggravation. And I know, I've cleaned up 1 trillion poop accidents in my life on people of all ages. And even for myself, I mean, I don't know how you could be any more trained than I am. And I've still had, I can feel an emotion overtaking me, right, as I'm elbow deep in feces. And we just need to keep taking care of ourselves, sort of like you just said, keep encouraging the parents and let them know that this is going to be mastered. He's not going to be 20 years old and still in pull-ups. It's going to be okay. And that we validate the emotional difficulty that it is for all of us when a child is taking longer than average, when potty training lasts a long time. It's a really emotional issue, and we have to take care of ourselves. It may be better for him to wear a pull-up for an hour than for everybody to get upset, aggravated, for him to get upset and aggravated. Safety comes before potty training, right? That's number one.
Can I
What
make a
what are you thinking,
suggestion?
Christy? Yeah, Christy and then Emily.
Okay.
Can you hear me? Sorry, I'm doing this on my phone. Can you
We
hear me okay?
can.
Okay. I'm a daycare teacher, preschool. I don't really have a bunch of children with a bunch of disabilities or learning capabilities that are not me. We're doing pretty good on that. But for the lady that was talking about the child having accidents out on the playground, one little nifty little tidbit that helped us kind of sort of. I'm not potty training disabilities right now, but I am currently in the midst of potty training a 2-year-old, my own personal child. And one little nifty little trivia is we always have a little go bag. So I have a tiny backpack. They're just an extra bag or something like that with extra clothes in it, undies and shorts. Toss some wet wipes in there for cleaning, some sanitizer wipes if you need for your hands, and obviously some gloves and everything like that. Little tiny trash bags for everything. So that way you can change them outside. And that pop-up tent is a great option. That way they'd have some privacy out there. But we've
That's
also
true.
had
Yeah, it could
a
be a
couple of,
changing room as well as a place
yeah.
to sit on a little portable potty.
Our playgrounds are like constantly wet with dew in the morning every morning. So we usually always have a bunch of towels out there and a bunch of teachers willing to make a little barricade and stuff like that. So nobody's being, their privacy is being hindered or anything like that. So just one option is having a go bag with you with extra clothes and everything you might need for an accident.
That's really cute. And I love the term go bag just because it's kind of a normal term. We all
Yeah,
have a little
if
go
it's
bag.
small
It's
enough,
really
if it's
very
small enough,
cute.
they could carry it up them with them, or the teacher can just carry it on there with them. I know we're usually carrying a bunch of stuff like water bottles and toys sometimes, all kinds of crazy stuff, but it kind of helps. Um, I again, I don't have any children that I'm working with currently right now with disabilities, but I just kind of had a question about trying more fun ways to get my 2-year-old to tell me he's got to go poop. We're struggling with that at daycare, and his teacher, like, he'll just kind of poop in his underwear, and I'm getting like the dead stares. Like I can tell when he's needing to go, and I can catch them. And I know his teacher's got 9 other kids in the classroom, so it's her
Yeah,
priorities
he's
are all
just
over the
young.
place.
He's just young. I
Okay.
think that he just doesn't have that skill yet.
Okay.
When you catch him
Just
at home and you can tell he needs to go, you can say, "You need to potty, potty,"
yeah, we've been really
and keep
strong
practicing
on
it.
going with telling, like I'll ask him, what is your body telling you right now? Is it, instead of me asking him, do you need to poop? Because usually he just says, no, no,
Right.
no. I've tried to phrase it more as a question of, what is your body telling you right now? If I see that look, is it time that you need to use the restroom? That kind of question lines.
Perfect.
But
Keep it up. You
um,
will be successful.
And I'll tell you this,
Just
Christy.
not 100% yet.
I know that a lot of 2-year-old classrooms are set up for potty training, but
mhm.
when I talk to my pediatrician, I have 2 boys, and my youngest does have autism, but he's in level 1 autism. Um, but what he said is that when boys come in for their 3-year-old checkup, less than 50% of them are toilet trained at 3 years old. You really, even though the classroom is set up for 2-year-olds to toilet train, it's still very much a 3-year-old skill too. So really um, don't feel bad if that isn't
Yeah,
happening.
don't sweat it. Exactly right. I think his situation is developmentally normal, or actually probably developmentally advanced where he is.
So, well, I want to thank everybody for your time tonight. Thank Dr. Bundy and Haley for their time.